Namaste, I am Dr. Siri, infertility expert practicing for more than 15 years at Sai Karuna Fertility and Maternity Center, Nagarbavi, Bangalore. The cervical cancer vaccination is also called as HPV vaccination. First, let me tell you the burden of the disease. It is one of the leading causes of death in women in India and abroad. So, the first most leading cause of death is breast cancer, second being cervical cancer. So, what is the cervix? Cervix is the small area of the uterus at the entry of the uterus. So, this cancer is very common, and the most difficult part to treat is usually they become symptomatic only when the stage of the cancer is advanced. So, prevention is something which is advisable. Since we know that the disease burden is so high that one woman every 5 minutes is dying because of cervical cancer, it becomes even more important to immunize our women, girls for this and prevent the cervical cancer. So, HPV is one of the most common sexually transmitted virus, and nearly 80% of the unvaccinated women are infected with HPV. So, who gets cancer? Do all who have infected with HPV get cancer? No. Although most of them are asymptomatic and gets cured by itself, some persistent infection in women can cause anogenital warts and can lead to cervical cancers. So, this vaccine is basically for that virus, that human papillomavirus, which causes this cancer. So, who has to take? It is a misconception that it's only the women who have to take the cervical cancer vaccination, because it is seen that the same HPV virus also causes penile cancer, anal cancer and oropharyngeal cancer in men. So, it is advisable that both men and women take these vaccinations, and especially the young boys and girls are advised to take, because below 15 years of age there is only 2 doses of injection that needs to be given to the girls, that is age between 9 to 15 years, and for boys between age 9 to 15 years again there is only 2 doses that needs to be given. Post 15 years of age, it is 3 doses that needs to be given at the interval of 0, 2 and 6. And to what age are these vaccinations to be given? For women, it is advisable to take up to 45 years of age, and for men in India, it is advisable up to 25 years of age, although abroad they are giving vaccinations up to 45 years of age even for men. And there are 2 varieties of HPV vaccine that is there. One of the injections that has 4 strains of HPV, which covers those 4 major strains which causes cancer, and there is another injection which covers the 9 strains of HPV, which are all the possible causes of not just cervical cancer but vulvovaginal cancer, anorectal cancer and oropharyngeal cancer. Irrespective of whether it is 9 strains or 4 strains or 2 strains, the dosage is the same. It is 0, 2 and 6 post 15 years of age. The 4 strain vaccine approximately prevents cervical and vulvovaginal cancer approximately 80 to 82%, whereas the 9 strain vaccine prevents these cancers, that is the cervical, vulvovaginal cancer, anal cancer and even the throat cancer, to a rate of around 99% is the prevention. The studies have shown no serious side effects so far, and the only few side effects could be a little pain or rashes at the injection site. Other than that, no major side effects have been seen, and this injection could be taken even by the lactating mothers, and except pregnancy being a contraindication, this injection may be given along with other medications also, and injection to be combined with other vaccines, they could be combined too. And there is no need of any booster dose as of now, as the research says, no need of any booster dose even when the injection is taken at a very young age of 9 or 10 years. The protection is for lifetime.